Happy day to all. This is Nivedita, founder of Sri Ahana Physiotherapy Academy. Our today's topic is going to be about the Trendlenburgs gait. This Trendlenburgs gait is caused due to the unilateral weakness of the hip abductor muscles. These are nothing but our gluteus medius and the gluteus minimus. This muscle is innervated by the superior gluteal nerve, so any injury or entrapment caused to this nerve will result in this kind of Trendlenburg gait. During normal gait, both the lower limbs will have to bear half of the body weight at some point of the stance phase. During swing phase, when one limb is lifted, the other limb will take up the entire body weight and it will support the body. The weight-bearing limb will undergo downward pelvic tilt and the non-weight-bearing limb will undergo an upward pelvic tilt. So this is the normal phenomena that has to happen. In case of hip abductor weakness, when the affected limb is lifted, what will happen is instead of the hip tilting upward, it will tilt downward. So there will be a pelvic drop. So to compensate for this pelvic drop, there will be a lateral tilt in the trunk which will shift the center of gravity to the stance limb, that is the weight bearing limb. So this compensation helps in minimizing the effect of this pelvic drop. Looking into the etiology of this Trendlenburgs gait, it can be caused due to the paresis or paralysis of these hip abductor muscles. This can be caused due to the nerve injury or nerve entrapment. And in few conditions like dysplasia of hip and congenital hip displacement, this hip abductor weakness can be seen. And for surgeries involving the hip joint where we'll have to cut the hip abductor muscles for the exposure of hip joint. In these situations, this hip abductor muscles become weak and it results in Trendlenburgs gait. Now talking about the differential diagnosis part, it is very important for us to note about the gait pattern from the side view also. In this side view, you can also check in for the gluteus maximus lurch. This happens when the hip extensor muscles are weak. There will be a posterior lurch in the trunk of the patient while he tries to walk. And one more thing that we'll have to look in for is the foot drop. Whenever there is a foot drop, it becomes difficult for the patient to clear the floor. So what happens is excessive hip flexion will take place to compensate for the lost dorsiflexion. So these are few things that we'll have to note while we look into the gait alone.
When there is gluteus medius weakness bilaterally, there occurs a wobbling gait.
That is, the trunk starts tilting to both the sides alternately during walking. So this is termed as wobbling gait. One more thing that is important in this Trendlenburg gait is during the stance phase, the tilt of the trunk will be towards the affected side. And during the swing phase, the trunk tilts towards the unaffected side. This is to compensate for the pelvic drop that is caused due to the muscular weakness. I hope this video would have made the Trendlenburgs gait clear to you all. Thank you.